Hi, everybody. Welcome to another session of Senior Center, Senior Citizens COVID advice from Mike Hirsch. I'm the Pandemic Chief Information Officer and the Medical Director for the Division of Public Health for the City of Worcester. And the government channel has been kind enough to give me a platform to kind of reach out to you on a monthly basis and just have a chat about some of the new developments in COVID that I know everyone's very concerned about. So it's December 2020. Most people, I think, will agree this has been a pretty terrible year. We've experienced almost 9,500 cases of COVID here in the city of Worcester, with unfortunately about 305 people succumbing to this. And we've also had an amazing community-wide response to it with the medical centers and the community health centers and third-party payers and the grassroots community organizations and the city government itself, all pitching in together to try to reduce the damage that this terrible scourge has done on individuals, on families, on businesses. And I think we've all told done a pretty reasonable job. We learned a lot in the first wave that was in the springtime, so that now, as this second wave has come, we have plenty of personal protective equipment, PPE, as you hear it abbreviated. We have plenty of ventilators on hand. We know a lot more about if you get sick enough to be hospitalized, how best to treat you, because we have convalescent plasma, we have the availability of monoclonal antibodies, we have protocols for introducing steroids, high-dose steroids, to combat the effects of the virus. We also know that if you end up in an ICU, how to best give you oxygen without having to put a breathing tube in. We call that intubation. If you do get intubated, if you do need to be on a respirator, we also know how to adjust the pressures to the best pressure and how to position you most of the time on your tummy to help get you through this. So the survival rate of the COVID infection has improved since the first wave came. But this wave is going to be bigger than the first wave. And sooner or later, the numbers kind of overwhelm all the things that we've learned. So that is a real concern for all of us, especially since, as I'm filming this, we just got through the Thanksgiving weekend. And we know that many, many, many people either traveled or had travelers come and join them in their homes, despite the fact that we advise strongly that this year we should all kind of downsize our holiday expectations and try to keep this family unit intact. We call that a bubble or a pod. If you're living, say, with your daughter and her husband, or your grandkids and your kids in a family unit, that's your bubble. And anybody new that comes into that bubble, you can't assume that they do not have COVID. You can't assume even that your own family members that you live in that bubble with don't have COVID if they're going out to work, if they're exposing themselves to the other people in the community, because community spread right now is very high. We have last week, just looking at the numbers, 20% of the people who were tested, and we tested many more people than normal because people were testing before Thanksgiving to either prove that they could travel safely or prove that when someone came to their home that might be at risk, that the people in that home didn't have COVID. So that's why there were so many tests last week. 20% of the people, 1 out of 5, tested positive last week. That's very, very high percentages. And that's what's worrying us about the upcoming month. Christmas is coming. There's going to be similar urges to travel, to congregate, to be with our friends and neighbors in worshiping services, dinners, Christmas parties. And we think this event that just occurred, Thanksgiving, is going to show its peak of spread of the virus around December 15th. So if we have a big bump at that time, and then we have another spreader event in December at the end of the month when Christmas time comes until the New Year's holiday, January is going to be really, really rough. Very, very rough. And, you know, we're trying to mitigate it. The city manager and the mayor meet on a daily basis, and we try to communicate on a weekly basis with our press conferences the things that are on the table. The things that are on the table are things like lockdowns, which nobody likes that term or the actual event. But if you remember, back in the spring, we made it so that there was no indoor dining, there was no gyms and no beauty parlors and none of those kind of indoor events. And if you went shopping, it would be to pick stuff up at the curb or to have it delivered. There was nobody going inside Price Chopper or Stop and Shop or Big Y. So we're all trying to avoid that. We're all trying to appeal to the community to please continue to follow the 3 W's. Wash your hands, wear your mask, and then watch your distance. Make sure that you're 6 feet apart and that you are not congregating indoors with more than 10 people at a time or outdoors with more than 25 people at a time. We've been trying to enforce this in the restaurants too. The other restaurant rules that the governor has been promoting would have allowed us to go up to having 10 people at a table. We only allow 6 in Worcester. We're also not allowing bar seating in Worcester. And these are methods and techniques that we feel are going to help us stay out of trouble more so than other parts of the state might. But a lot of it depends on the community. We have to pull together as a community. I can tell you on the medical staff side, people are tired. This is very much like Groundhog Day. I don't know if you remember that movie from the 90s where the day repeats over and over and over again. Coming into work, putting on special goggles, special masks, and the gowns. It's hot. It's very, very distracting. You always feel like you're steaming up your glasses. You're sweating, and it's very unpleasant. And so far, the hospitals have decided not to shut down elective services like clinic visits and your WellCare child visits at your pediatrician, or operations that are done, quote unquote, electively. Because what we saw in the spring was by putting a lot of those operations and those clinic visits off, people were presenting in the summer with pretty severe illnesses because they had put off their well care. But I think, unfortunately, if the numbers go up because people haven't been compliant with all the recommendations about keeping their bubble intact, then we're going to see that lockdown come back. So I'm sounding pretty grim, right? It's the holiday season. I want to be cheerful. I am cheerful about a lot of things. I think As I told you earlier in this broadcast, I think it could have been a lot worse if we didn't have such great collaboration between city med centers, community health centers, and all those organizations that care about the underserved in this community. But I can't be totally honest with you and paint a rosy picture. I want to be honest with you. I want to tell you two things. One is, you as the elder of your family have a lot of influence on the family. And if you're seeing your children or your grandchildren, your great-grandchildren acting foolishly, taking risks, getting together and not distancing and not wearing masks, and really, getting together for football games and everyone's on the couch together and nobody is paying attention to any of the 3 W's, you're saying something about that to your youngins means something. And, when we say it in public health or when the city says it, it kind of sounds like one of those wah-wah machines sometimes. But you say it, it has a lot of weight. So you could be a big help to us in keeping your family in that bubble. The second thing I really can be optimistic about is vaccinations. So I wanted to spend a couple of minutes about vaccinations. They're coming. They really are coming. There are at least 2 companies, Pfizer and Moderna, whose products have been tested independently. This isn't like they tested and said, oh yeah, we have good results. No, they had independent companies come in and confirm that their particular product was 90 to 95% effective in building up the kind of immunity that we want in order to fight the virus. Now, if they get approval from the FDA, and both the products are now in the FDA's hands, it's usually a 2 to 3 week process at least for the FDA to review all the studies and how they were done. They might expedite it in an emergency fashion, but I think it realistically is going to take them most of December to give the approval for these. But those companies made a big gamble. They mass-produced the doses of this vaccine already. So it's not like they got to wait till production happens. The production is already out there. They just need the green light that the FDA approves them, and then they will distribute these to the various states and to the various communities. And because we were one of the Pfizer testing sites, we may be in line for an early batch of the Pfizer vaccine. The Pfizer vaccine is complicated because it requires a booster 21 days after the original shot. And it needs to be stored in a very special -70 degrees refrigerator that we have to get those distributed before we can actually take the vaccine. But our Division of Public Health, working with the Emergency Operations Center, has developed a plan for emergency distribution sites all over the city. And I think you're going to be very impressed at how we're able to get these vaccines out to the public. We have a small army of medical students and graduate nursing students from the medical school. We have doctors from the Worcester District Medical Society. We have volunteers from the Worcester Medical Reserve Corps. And we will probably be recruiting from some of the other nursing colleges like Becker and Mass College of Pharmacy and Worcester State University to help us in this effort. It's going to be an all-hands-on-deck thing, because if we can achieve 70% vaccination rates in the city and in the country and in the world, we have what's called herd immunity. Herd immunity means that so many people have been vaccinated and are not going to get the disease that the other 30% that are not vaccinated won't get exposed to the viral load that they would need to get the disease. Right now, there's so much viral load out there, there's a lot of spread going on. But once we get to 70% herd immunity, we're not going to be spreading. So I predict that this time next year, right at Thanksgiving time, 2021, we will have that herd immunity and we will be able to have holidays like we like, with hugging and gathering around the table and actually having to break bread together and really give thanks as a community, as a family, for all the blessings that got us through this thing. And for the unfortunate 300 families that lost a loved one in the Worcester city confines, I'm really deeply sorry, and I send my deepest condolences to you, because this was a scourge that we didn't necessarily anticipate, but the reaction to it nationally really slowed us down. And now we're finally getting into a point where I think the distribution of the vaccine, once it's approved, is going to be astonishingly fast. So the phases of the vaccine that are going to exist in phase 1, medical providers and first responders and folks that live in long-term care facilities and the workers that work in those facilities are going to get vaccinated, because that's a really vulnerable population, and we need a healthy medical force in order to take care of people that get sick. Then the next phase is going to be vulnerable populations. That's populations in the community of color, that's the elderly, people over the age of 60, that's people with what we call comorbidities, other illnesses that COVID seems to strike more readily, like lung disease, heart disease, diabetes, cancer, immune problems. All of those diseases lead to being an easier victim for COVID. That's phase 2. And a lot of the work there is going to be done by the community health centers, because that's where a lot of the vulnerable populations get their primary care. And the third phase is going to be in general distribution, pretty much run through the pharmacies. And CVS has already indicated to us that they're going to have a huge consignment of vaccine. I'm sure Walgreens will be the same, so that's where the general public will probably get a lot of their vaccinations, plus our vaccination crew that we've put together for the Worcester Department of Public Health. So that's reason for real encouragement, but because, again, the vaccine is going to be given in phases, because it needs a booster shot a month later after your first dose, it's not the quickest fix in the world. I think it's going to be a period of about 8 to 12 months for us to get that kind of herd immunity that we want. But here again, you, as a person who's lived potentially long enough like I have to remember the polio vaccine and the measles, mumps, and rubella vaccine being developed in the 50s and 60s, you know that vaccines have really changed the landscape of people and what they're dying of, and particularly children. You're saying a kind word about vaccination would be really, really helpful. So I want to give you one more set of facts about why you could actually be an advocate for getting the vaccination. A lot of these other vaccines that I just mentioned, polio, measles, mumps, rubella, flu vaccine, all of those vaccines involve in some way, shape, or fashion injecting into your muscles a dead version of the virus that we want your body to start building up antibodies to. Sometimes it's actually a live version of the virus. That's the Sabine polio vaccine that you drank. That was actually a live form of the virus, but with an alteration so it didn't make you sick. This is a totally different kind of virus. It's a vaccine. It's the first of its kind. They're actually taking a messenger of genetic information from the COVID-19 virus and implanting it into you so it makes your cells create antibodies to the proteins that are on the outside of the coronavirus. If you've ever seen any of these pictures of the coronavirus, they always do it up beautifully. They have a kind of like a blue globe with these red spikes on them. It's the spike proteins on those spikes that this new kind of vaccine is going to tell your body to make antibodies to, and it destroys those viral cells. So it's not making a virus in you, it's making an antibody to a part of the virus that will shatter the virus. And the word so far from both the Moderna company and the Pfizer company is that the level of antibodies that your body has are much, much higher after the vaccination than people that got actually the disease in March and now got tested for their antibody levels. They don't make nearly as much antibody to the virus as the vaccine provokes. So it should be a really, really good way of keeping you from getting the virus. And it may actually be one of those one and done things. We don't know yet. It may be that after we study this over a few years, we realize all you need is the one shot, kind of like what you get for shingles or measles, mumps, and rubella. You get the one shot and you don't have to get it again. So that's really good reason for optimism. But we're going to have to work with, 3 different groups of people that don't necessarily want to get the vaccination, and you can help us with that. On one side of the political spectrum, there are people that are anti-vaccination. They feel that vaccination up to now has been mixed with the infusion of some types of metal that have maybe influenced the creation of the autism epidemic that we're seeing in this country. That has never been proven, and the one paper that brought it up has been totally debunked. The scientist that did this in England actually had to recant all of his data, but still the damage was done, and a lot of those people don't believe that vaccine is healthy for children. Then there's a religious group, Orthodox Jewish people, some more fundamentalist Christian faiths, some very fundamentalist Muslim faiths do not believe in vaccination. We also have the community of color and the Latinx community that have some mistrust about doctors in general because of historic maltreatment of those communities with experiments that were done without their knowledge. So we understand that the vestiges of those mistreatment episodes is hurting us now. And the other group that doesn't like vaccinations is just a group that doesn't believe the government should be telling us what to do. But I am hopeful that this pandemic maybe has turned some heads. We need this vaccination to work. If we don't get this vaccination to work and to have enough people that get the vaccination, we will be living through this hell of masking and distancing and economic devastation from shutdowns and lockdowns for years to come. And our economy is a train wreck as it is now. It can get worse. So, in summary, I would say there are a couple of pieces of good news. 2020 is almost over. That's definitely one piece of good news. Number two is we got through 2020 here in the WU, and we got through it better than a lot of communities. And I think that's a tribute to how serious the community took our warnings to do the 3 W's and to be careful. And number 3, vaccines are coming. And with that comes the hope that we get the herd immunity that we need to keep Worcester open and touching each other again. You remember touching people? I think there used to be an old, I think it was maybe a telephone commercial, reach out and touch somebody. They thought about the phone as doing that. The phone doesn't cut it. I mean, we need some hugs. We're not getting hugs. So I'm giving you a virtual hug, and I'm begging you as the elder of your family, please use your influence to tell people to keep watching our press conferences every Thursday, to listen to the guidance that we're trying to provide. We're trying to give the straight talk as we can, and also get ready for the vaccine when it becomes your turn. We want you to get it. We want you to be disease-free, and we want 2021 to be a total turnaround from this awful year. In the meantime, I once again will wish you the happiest of happy seasons, regardless of where we are and whether we're in a bubble and whether we're locked down. The things that almost all the religions celebrate towards the end of this month is the fact that miraculous things happen. And I am a believer. I'm not a Christian, but I am a believer that miraculous things have happened here in Worcester and will continue to happen next year. And I thank you for listening, and I thank you very much for the opportunity of talking to you every month like I have. So be well, be safe, 3 W's, and see you in January.